I get pregnant if I have PCOS? That's the most common question that every young woman who wants to get pregnant and has PCOS always asks me at my place of work. Well, the answer to that question is yes. Because you have PCOS doesn't mean that you can't get pregnant. Yes, it is true that PCOS is one of the most common cause of infertility, but a treatable one for that matter. Just that you'll be needing some medical assistance. Well, to be honest with you, there will be a little bit of delay, but definitely it is possible. Hello guys, welcome to my YouTube channel. In this channel, we discuss everything regarding what health. If you are meeting me for the first time, my name is Pcod Pcos. I'm a registered nurse, a registered midwife, a registered public health nurse, and a BSc in nursing science. If you are interested in this video, please stay tuned and watch. So today we'll be talking about PCOS, which is one of the common topics people has really requested a couple of times to be discussed. You know, it has been noticed that 1 in every 10 women have PCOS. Like, it has become a gynecological epidemic. You remember back this, like, let's say past 20 years, 30 years, we didn't hear anything about PCOS, but all of a sudden the thing became rampant. Like the incidence became so high to the extent that September, like this past month that just finished, is now being allocated as the month for celebration of National PCOS Awareness. Well, PCOS is really a broad topic to discuss, so it's not something that you will discuss in one particular video. So stay tuned for you to learn more about PCOS. But before I dive into what PCOS is, I need to make a clarification. PCOD, PCOS, and PCO, although all of them are in one meaning though, but there is a difference. PCO is when the disease is only limited to the ovary, but when it starts showing its effect on other parts of your body, such as you having high blood sugar, high blood pressure, obesity, and some sleeping difficulties, at that point in time you will term it as PCOS, as polycystic ovarian syndrome. Then PCOD is now an umbrella covering the two of them. Now, what is PCOS? PCOS is a condition that affects women's hormonal balance, often leading to irregular period, causing them to have excess male hormone, especially the androgen, and then affecting their ovulation. 50% of women go undiagnosed without even knowing they have PCOS, whereas 50% are also at risk of having diabetes, especially type 2 diabetes and even pre-diabetes. Same 50% are at risk of endometrial cancer. So you really have to learn, understand, and treat yourself of this PCOS. Now to the symptoms of PCOS. They include irregular period, scanty or even delayed period. That's number 1. Then number 2 is weight gain or even inability for you to lose weight. Number 3 is when you have male pattern hormone in excess, for example the androgen hormone, and that will present with excess as seen, like you having pimples on your face, you having husky voice, scalp hair loss, increased hair on your body, most especially in your upper lips here, your chin, your side, and even your chest. Other symptoms include infertility, difficulty sleeping, sleep apnea, you snoring a lot of daytime sleeping, mood change, even anxiety and depression. Now, what are the causes of PCOS? Well, the exact cause is unknown, but it is linked to genetic and environmental factors. Genetics in the sense that it runs in your family. Science made it known to us that if someone has it in your family, or maybe there is a trait of such in your family, there's a likelihood of you having PCOS. Then number 2 is poor lifestyle. Maybe you're practicing sedentary lifestyle, you don't exercise, you expose yourself to wrong diets, you lack good quality of sleep, and then expose yourself to stress. Those things are poor lifestyles that can predispose you to having PCOS. Another cause is insulin resistance. Insulin is a hormone that is being produced by the pancreas. So what the insulin does is to regulate the blood sugar level in our body. So it helps the cell to absorb glucose from the bloodstream and then use it up for energy, or rather store it for later use. Now, how does it play a role in causing PCOS. When the insulin is not able to do its job, which is regulate the blood sugar level, the body will try to compensate by producing high amounts of insulin. Now that high amount of insulin will now go and stimulate the ovary to produce abnormal hormones, which is mostly the male hormones, the androgen, causing the above symptoms I mentioned. According to researchers, presence of chemical pollutants in our body is being seen as one of the causes of PCOS, like when you always use plastic, aluminum foil, all these air freshener we use at home, that they contain some chemicals that affect the hormone in our body. So another cause of PCOS is chronic stress. When you expose yourself to stress, it can trigger the ovary to produce abnormal hormones. Now, how can you diagnose PCOS? Now, there is this criteria. We call it Rotterdam criteria. It is used to define whether someone has PCOS or not. So it involves 3 criteria. And those criteria include: number 1, having irregular period, delay or scanty periods. Then number 2, you having this excess male hormone pattern like androgen that presents with a sing, husky voice, you having hair and loss of scalp. Number 3 is when you carry out ultrasound and it indicates that you have maybe like 12 or more follicles of cyst, like ovarian cyst in your body. So presence of any 2 of the above confirms the diagnosis. Another investigation to carry out is blood test in order to measure the level of testosterone, androgen, luteinizing hormone, or even follicular stimulating hormone. So that is it for what PCOS is, the causes, the symptoms, and how you can diagnose it. So in my next video, we'll be talking about how it affects pregnancy, and then the management and treatment you have to undergo in order to ensure that it is being treated. Remember, I told you that PCOS is a broad topic. It's not a topic you discuss in one video. So stay tuned to be watching step by step and to learn more about what PCOS is. So if you really enjoyed this video, I would really appreciate it. You comment your thoughts on the comment section, subscribe to my YouTube channel, and even give it a thumbs up. So see you in my next video. Bye bye.